Hi, good evening all. It's my pleasure to be here tonight representing Mingpo Daily News. Now, Mingpo Daily News has been working with ACCE on this event since its inception, as we strengthen our support every year. Now, Mingpo had published a special magazine last year as to introduce the Gala and also all the award winners of 2009 to the public. This magazine was also delivered to Mingpo readers in addition to our regular circulations. 3,000 more copies were distributed. The result is encouraging. For this year's Gala, we have made another step forward with additional support and to focus in 3 major areas. First, that is the most important part to me, to promote the image and our knowledge on the previous award winners. Now, as we understand, the public concern about the previous winners, the award winners' success can be a good reference for them. So we published a series of stories in last November. The story is to update the public that the contributions from most of the award winners, the previous award winners, have not slowed down. And it further confirms that they are not only the focus of the Gala, but also the all-time winners in the industry and also in the community. Second, we have increased the promotion in CCE, Canadian Chinese Express, a weekly newspaper published by Mingpo and printed in simplified Chinese. Now, this is one of the most effective ways to promote the event to another huge Chinese sector, especially readers from mainland China. And last but not least, the second issue of the special magazine that introduced the Gala, the sponsor and all the award winners of tonight, will be published on the Monday after next week. And the magazine will be once again distributed with Mingpo. So please don't forget to get your copy of Mingpo Daily News on April the 19th. Now, ladies and gentlemen, I think it's time for me to invite you all to join me to welcome the Best Community Award winner of the year. And the winner story will be also covered in the upcoming magazine. Thank you. Thank you. And the award goes to Dr. Ming Chow of C.M. Chow Medicine Professional Corporation.
Congratulations, Dr. Ming Chow. Please watch the video.
Dr. Ming Chow is a well-established medical professional who is very active within his community, a man who has definitely made a difference. Dr. Chow is Vice President and incoming President of the Chinese-Canadian Council, Heart and Stroke Foundation. For many years, Dr. Chow has made it a priority to promote health and wellness to the public, paying particular attention to the Chinese community. In an effort to do this, he has served as co-chair of the HSFO Chinese Public Symposiums for several years. He is the producer and medical consultant for a series of Chinese DVDs entitled Taking Control. The series looks at heart health and lists preventative measures each of us can take in order to make our lives and heart more healthy.
I have lots of interests when I was growing up. I have lots of interest in public speaking, in working in the media, for example, the radio, sometimes in TV as well as newspaper. And I developed an opportunity to learn how to actually speak on the media as well as in communication. And once I become a doctor, I use this skill to actually help in doing public speaking as well as public education in terms of heart health, because I'm a cardiologist. And day to day, I have the opportunity of taking care of patients. But within a year, we can take care of probably about 1,000, 2,000, maybe 3,000 patients.
These DVDs are being distributed by the Heart and Stroke Foundation to the Chinese-speaking community across Canada and around the world. Dr. Chow also makes numerous appearances on national and local television as a spokesperson, relaying vital information and news about cardiovascular health to both the Chinese and mainstream media. Dr. Chow is an attending staff cardiologist at St. Michael's Hospital and an associate professor of the Department of Medicine at the University of Toronto. He also has an undergraduate degree in computer science from Brown University and has completed his Doctor of Medicine and a Master's of Science in Epidemiology from McGill University. And as if his days weren't busy enough, Dr. Chow has also found time to author a number of popular medical education software programs which are being widely used by medical professionals and students across the globe.
In Chinese, we have a saying, 有錢出錢，有力出力, meaning that if you have money, you can contribute money, and if you have energy and effort, you can contribute your energy and effort.
His contributions to the medical community, as well as the Chinese community, have not gone unnoticed. He has been the recipient of the coveted William Goldie Prize for Innovation by the Department of Medicine, University of Toronto, the John Rudy Award for Innovation in Medical Education by the Association of Faculties of Medicine of Canada and Dalhousie University, as well as receiving the Heart and Stroke Volunteer Award of Excellence in 2007 and 2008. Dr. Chow even had a hand in helping spearhead the building of the Chinese gates in Montreal's Chinatown. And tonight, we recognize this great man once again for his commitment to medical excellence, his devotion to educating the public about cardiovascular health, his countless volunteer hours, his tireless efforts to make a difference in the lives and health of others. We award Dr. C.M. Chow the 2010 Best Community Service Award.
Congratulations, Dr. Ming Chow of C.M. Chow Medicine Professional Corporation. This award was nominated by Ms. Phoebe Chow. Would Dr. Chow please come to the stage to receive his award?
Thank you, Cyril.
So, ladies and gentlemen and honored guests, it's indeed a privilege to stand in front of all of you to have this prestigious award. I'm sure many of you are volunteers as well, including many of the ACCE board members have put a lot of time to do the effort as well as organizing this event and recognize many distinguished individuals. I'm very fortunate to be here. And this actually is a great award for me. I'm really, really honored. And this marks the 20 years of actually being called a doctor, except my mother-in-law and my wife. Speaking of my mother-in-law, I really want her to be the first one for me to recognize. She's right over there. And she is the one who inspired me to become a volunteer. When I first came to Canada, I got picked or suggested to volunteer at a local Chinese radio station called Radio Centreville. And that's where I first met them and her daughter. And since then, you know, she taught me a lot about public speaking and as well as doing radio programs. And she remains the most critical person whenever I appears. And, you know, if she said, okay, then, you know, I did okay. And among all that, I also want to thank Heart and Stroke Foundation for giving me the opportunity, and Laura Siren, our VP of Research as well as Mission, is here. She is the main driver behind our Chinese-Canadian Council and Heart and Stroke, as well as supporting us for all the efforts and all the activities that we do in the Chinese community. And also want to acknowledge Helen Leung, who is the CEO of Care First. She's also supported me a lot, although I'm not an official part of Care First, but I feel like a family member to Care First as well, which I've done some work along the way, as well as being a member of the family health team, helping the Chinese-speaking patients. And last but not least, I want to thank my wife as well as my children. They have actually sacrificed a lot because there are lots of late evenings as well as weekend lectures and so on and so forth that I could not be home with them or playing with them or teaching them alphabets and so on and so forth. Once again, I want to thank you, and in many ways, this is a fantastic thing. 46% of the Canadians actually volunteers, and that accounts for millions and millions of people. In my situation, I got a lot out of it, and in my situation, I met my wife through volunteering as radio DJs back in the Montreal radio station. Once again, thank you, and have a wonderful evening. Thank you.